Эпоха спейслифтинга в России началась.
The era of spacelifting in Russia began in 2011, when we returned from Melbourne after completing our training by Dr. Brian Mendelsohn. It was a unique course, and the great luck is to get on it. 3 years of waiting have justified our hopes. Not only is it the flip side of the planet, this is also a very small chance of being among the 16 participants invited only once a year. This was only the third course on this subject. From Russia, we were the first, but as far as I know, not the last. The acquired knowledge and experience became a milestone at the beginning of the popularization of spatial facial surgery in Russia. We introduced and registered the term spacelifting that was approved by Dr. Brian Mendelsohn. He confirmed that at the Congress in St. Petersburg. Now, spacelifting is a technique rapidly gaining popularity. Dr. Mendelsohn, seeing our successes in the application of facelifting technology in Russia, suggested organizing a similar training in Moscow. Unfortunately, because of the pressure of work in the surgeons community, this proposal has not yet been implemented. But we haven't abandoned this idea. Since 2011, we have performed more than 3,000 spacelifting surgeries. The result fully satisfied not only surgeons, but also, which is more important, our patients. We came to complete refusal from a traumatic circular facelift. As a result, the time of the spacelifting intervention and the time of recovery have significantly decreased. With the introduction of spacelifting, we have never faced unsolvable problems. The principles of facial rejuvenation by spacelifting differ from traditional technique and are based on selective work with each face, zone, or space. The first is a restoration of the cheekbone area of the face. The second is cheek lift, and the third is a return of the neck muscles to a young position, as well as prevention of ptosis. The classic circular lift is devoid of such possibilities. With sufficient experience, the duration of the spacelifting is about 2 hours, and the rehabilitation time lasts 1 to 2 weeks. On the 7th, maximum the 10th day, our patients return to normal life. In the case of the circular lift, the operation lasts more than 5 hours, and it takes more than a month to recover. Plus, spacelifting is characterized by short sutures. The classic lift requires a near circular cut, hence the term circular lift, an unfortunate but accurate term describing the horror of relatives and the pain of patients. Spacelifting refers to a type of surgery with a short postoperative suture. The sutures are well hidden in the auricular, ear flap, and skin folds. The suture doesn't stretch. Over time, it almost disappears, and the main advantage is the natural look of the face after the surgery.